PureSleep Pro is a mandibular repositioning device used during sleep to reduce snoring and treat mild to moderate obstructive sleep apnea in adults. It's designed to reposition the lower jaw by moving it slightly forward, opening the upper airway to decrease snoring vibrations and encourage increased airflow. Before prescribing PureSleep Pro, it's important to review the contraindications, warnings, use, and safety information found in the fitting instructions. Do not use for patients who have central sleep apnea, a severe respiratory disorder, loose teeth or advanced periodontal disease, or are under 18 years old. The use of this device may cause excessive salivation, tooth movement or changes in dental occlusion, gingival or dental soreness, pain or soreness to the templar mandibular joint, and obstruction of oral breathing. Dentists should consider the patient's medical history, including history of asthma, breathing, or respiratory disorders, or other relevant health problems, and refer the patient as needed to the appropriate healthcare provider before prescribing the device. The device is not recommended for use by patients who have had a dental implant within the last 3 months. Now, it's time to prepare and fit PureSleep Pro with the following simple steps. Step 1. Prepare to fit the device. Prior to fitting the device, have the patient remove any partial dentures and brush their teeth to minimize the possibility of food particles being embedded during fitting. Have nearby 1 to 2 quarts of water to boil in a medium-sized pot, a spatula to remove the device from the hot water, and a timer that shows seconds. Choose the device setting that will facilitate the desired degree of mandibular advancement, and attach the upper component pins into the lower component holes using that setting. The top and bottom components of the device are designed to fit together. The top component has 2 plastic teeth that extend down from the front of the device to provide structural support during the fitting process. It also has 4 plastic pins, which fit into holes in the bottom component. There are 3 possible settings when mating the top and bottom components of this device together to accommodate 4 bite types. For type 1 occlusion, use the 2 holes closest to the front, so there is no offset between the upper and lower components. For a mild type 2 occlusion, use the 2 center holes, which facilitate a 3.4 mm offset between the upper and lower components. For a severe type 2 occlusion, use the 2 back holes, which facilitate a 6.8 mm offset. For a type 3 occlusion, use the 2 center holes, which facilitate a 3.4 mm offset between the upper and lower components, and invert the device for use. Within each setting, it is possible to achieve a range of advancement based on the degree to which the patient advances the mandible while making an impression. Step 2. Prepare the device. Bring 1 to 2 quarts of water to a low boil. The water should be deep enough to submerge the entire device. Remove the pot from the heat source, and using a spatula, immerse the device into the water for 1 minute to soften the inner moldable material. Remove the device from the hot water and let it cool for 15 seconds, while ensuring that the upper component is on top, unless using it in an inverted orientation to treat patients with a type 3 occlusion. Test the temperature on the back of your hand to ensure it is cool enough to place in the patient's mouth. Step 3. Fit the device. Have the patient open their mouth and thrust their mandible forward as far as it is comfortable. While the patient is holding their jaw forward, place the device in their mouth and have the patient bite down firmly into the warm, softened material. Have the patient hold this position for 45 seconds. Then remove the device from their mouth and place it under cool, running water to set the impression. For greater comfort, trim away any excess displaced material. The impression may be retaken up to 3 times if a sufficiently deep impression is not made. Simply repeat the process. However, once boiled, you can't change the setting. So once again, it is important to determine the best setting prior to fitting. Step 4. Check the setting and advise the patient. Put the device back in the patient's mouth to check that it fits properly. When wearing the device, the patient should be able to feel that it's holding their mandible in an advanced position, yet it should still be comfortable. If it's not, you may try repeating the process with the mandible slightly less advanced. However, to achieve a significant modification in mandibular advancement, it may be necessary to start over with a new device. If the setting used does not sufficiently resolve the patient's symptoms, try fitting another PureSleep device, this time instructing the patient to hold their mandible in a somewhat more anterior position during the fitting process. It is good practice to conduct a sleep test to ensure adequate treatment of OSA. It is normal for the jaw to feel sore for the first 2 days, or for the jaw to be a bit forward of its normal position in the morning. Advise your patient that maximum comfort may not be immediate, and it could take several days to get used to wearing the device. It's normal for the jaw, teeth, and gums to feel moderately sore and fatigued for as long as 5 days as the patient acclimates to the new jaw position during sleep. Also, if they do not use the device for several days, they may need to reacclimate. When the patient removes the device in the morning, their mandible will tend to stay anterior of its normal position. Their jaw should move back into place naturally and comfortably shortly after removing PureSleep. The patient can aid this process by gently pushing their jaw in a posterior direction while relaxing their jaw muscles and holding this position for about a minute, and also by gently massaging their jaw while trying to relax their jaw muscles. Advise patients using the device to brush their teeth and remove partial dentures before use. Not let anyone else use their device. If they wake up bothered by the device, take it out and go back to sleep. They should be able to sleep longer with it each time they use it. Stop using the device and contact you if they feel acute jaw pain, if they continue to experience pain beyond the first 5 days of use, or if they continue to experience pain for more than 5 days after discontinuing use of the device for any reason. The device can be cleaned with a toothbrush and toothpaste or soaked in water with effervescent oral device cleaning tablets, according to the manufacturer's instructions. It should be stored in a cool, dry place. Remember, it can take up to 3 to 5 nights of consistent use to get used to wearing the device. Discover PureSleep Pro, the doctor's prescription for apnea.